Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. We're here, as always, to take your COVID questions and to talk about the work of the Health Department. As you can see, we're joined by a special guest today. This is Matt Richards. He's one of the Deputy Commissioners at the Chicago Department of Public Health, and he oversees our behavioral health work. We've gotten a lot of questions in over this whole time frame related to COVID and mental health and substance use and what is the department doing, and so we decided to have him come in to talk a little bit about that. We also will definitely be taking your questions. If you had a little bit of trouble finding us today, we are on a different channel, so you found us hopefully on the CDPH Twitter and Facebook channel, and if you don't follow the CDPH Twitter and Facebook channel and normally you're watching us on the Mayor's channel, please do follow us there, because that's where we post a lot of data. We're often sort of having more in-depth conversations, and the mayor is running a press conference on her channel. So we will not be looking directly at the dashboard, but we'll speak to the numbers and we'll pop some more of the information in the chat. So today is Thursday, July 29th, and as always, you can start putting your questions directly into the box below or use the hashtag AskDrArwady on Facebook or Twitter. So to start with Matt Richards, welcome. Can you tell us just a little bit about yourself and the work of the department?
Yeah, thank you for having me. So my name is Matt Richards. I'm the Deputy Commissioner of Behavioral Health. I'm a licensed clinical social worker. I oversee the department's mental health, substance use and recovery, and violence prevention programs. Obviously, during the COVID pandemic, there were a lot of challenges related to all the areas that I work in, and we can talk in more detail about that. But there's a lot going on right now. We're doing a lot of work in the overdose prevention space because we've seen concerning upticks in the number of overdoses in the city and nationally over the last particularly 2 years. We're integrating mental health professionals into the city's 911 system, and that's starting shortly. And obviously violence continues to be a significant challenge, and I think a real interest in public health approaches to violence reduction that are complementary to more traditional law enforcement approaches. So I work on all of those issues.
All right, it's a busy part of the department. So if you want to start putting in some questions for Matt, I'll go ahead and do a quick overview of our data, hit a couple of the COVID questions that we've been getting a lot of, and then we'll come back and talk some more based on your questions for behavioral health. So first of all, you should, as always, go to chi.gov/COVID- to see our dashboard. We continue to update that every day, Monday through Friday. Today, we are averaging 185 new COVID diagnoses per day. Our positivity is at 2.9%. We're averaging approximately 8 hospitalizations of Chicago residents every day, and we're still between 0 and 1 COVID deaths every day. And when you put that in comparison to the more than 5,600 Chicago residents that have died from COVID, certainly I'm glad to see those numbers where they are. But let me say right off the bat that a lot of you have been writing in with questions about how does that line up with the new CDC guidance. So we heard from Jess P. on Twitter, Becca Wood on Facebook, Kristen Korkowski on Facebook, all asking about the new CDC recommendations and how does that match up to our numbers here. So we'll post some more information about this online, but let me translate this for you. So on Tuesday, the CDC put out nationwide guidance that there were, strongly doubling down on how important it is to get vaccinated. But I think the two things that have the most relevance for us here is, number one, they recommended that all schools, K through 12, should be fully masked, regardless of vaccination status, at least as we come back into the school year. As you know, that is already something that Chicago Public Schools was planning on doing, but I know that it is a larger conversation. And really that's recognizing the fact that all over this country, we are seeing significant surges of COVID that's being driven by Delta. The youngest children obviously are not eligible to be vaccinated yet, kids under 12, and across the whole country, fewer than half of our adolescents are vaccinated. There remain many adults who are unvaccinated, and the operational burden of trying to know who's vaccinated and who's not is a real challenge. And so I was pleased to see that. I will tell you that's something that the American Academy of Pediatrics has weighed in on. Chicago Department of Public Health has also recommended this is definitely the best way to mitigate that risk, at least as we start the school year and work on getting more and more people vaccinated. So that was number one. The other thing that really has relevance for us here is that the CDC recommended that in parts of the country that have what they were calling substantial or high transmission, that jurisdiction recommend indoor masking for everybody, regardless of vaccination status. And they define that with particular, cutoffs based on your population. The good news, and this is not by accident, is that those cutoffs are basically in line with the numbers we have been using all along here. So 3/4 of the country's counties approximately already are at the substantial or high mark. Most of Illinois is, most of downstate Illinois is actually already at that high mark. Here in Chicago, when we cross that 200 cases per day threshold, the same one we're using all along, that moves us into what CDC is calling the substantial risk, the sort of moderate to substantial risk. And when we move to 400 cases per day, again, what we've been using all along, that's when we would move from that moderate or substantial into the high risk. So sitting at 185 average cases per day and increasing, I do anticipate we will be moving very shortly into that substantial risk category. Now, I want to be clear because I'm already seeing comments. This is not Lala, to be clear about that. And I know that there are lots of opinions, and we can certainly talk a little bit about that, but we talked a lot about that last week. But this is related to the Delta variant and the fact that it is here and it is spreading. Unfortunately, although Chicago is doing better than the great majority of the state and the great majority of the country, we are seeing those increases. One other thing I just wanted to highlight, and so I would expect that, as we watch this over these next few days, I wouldn't be surprised if by, early next week we're making some formal announcements about that. I'm also seeing a number of questions about breakthroughs. And again, we will be posting some more graphs. Our epidemiologists have put together, I think, some really nice graphs that show with Chicago data what cases have looked like for people who are unvaccinated, partially vaccinated, and fully vaccinated. And we'll get those up online. If we can, we'll even put them in the comments. But basically what we see is we're going back to March, much higher rates of cases, hospitalizations, and deaths among people who are unvaccinated. We see a low to moderate increase among people who are partially vaccinated, meaning one of their 2 doses. And then we have really seen low rates and continue to see quite low rates, not zero. None of these vaccines are 100% effective for all of those. And I see, we had a question here, brother number 2 on Twitter is asking, can you reveal the age and comorbidities of those who died? Every time there is a breakthrough infection, every time in the city of Chicago, if we either see somebody get COVID for a second time, be diagnosed with it, or we see somebody get COVID who has a record of prior vaccination, we are keeping track of that. If they are hospitalized, or especially if they die, either of those, we are doing a full investigation. We're looking to see what vaccines they got. We've not seen one vaccine stand out there. We're looking to see what risk factors they had. We're looking to understand that. And then we're especially prioritizing the genomic sequencing to see what is this. We are seeing the majority of cases across the board, not just breakthrough, be Delta, as we are seeing around the country. And so to give a little bit of context for this, if you go back to January, right, which is approximately when we started having the vaccine available, we've had in the vicinity of about maybe 780 deaths total from COVID-19 in Chicago residents. So there have been about 5,600 deaths in Chicago of COVID, and about 780, 800 of them in this year, 2021. In this year, 2021, of that approximately 780 people, we've had 21 breakthrough deaths in people who were fully vaccinated. So that means 97% of our deaths, just like 97% of our hospitalizations, have been in people who are not fully vaccinated. Among those 21 people, the median age was 79, and all of them had underlying conditions, which just highlights, right, some of the risk factors that we've been seeing all along, are still there. I don't want you to hear this as, oh my goodness, this is so many people, because again, 21 people is 3% of the deaths that we have seen. And I have certainly we have concern whenever we're seeing this and there's additional work that's happening in long-term care, et cetera. But the huge majority, 97% again, in people who are not fully vaccinated, and that pattern has been holding true. So please, get vaccinated. Okay, let's go ahead and I'll answer one more COVID and then we'll get into some of the specific ones. A bunch of questions here related to testing, which doesn't surprise me. As we're seeing cases go up a little bit, we want to remind folks that if you are having symptoms, you got to stay home. This has not changed until you get a COVID test. If you want to go get a formal COVID test, chicago.gov/COVID test, or you can get there off our regular. We haven't changed our website there, chicago.gov/coronavirus, but chicago.gov/COVID test will bring you to literally the hundreds of places around the city where you're able to get COVID testing done. You can also order, as we talked about on here, you can buy over the counter from CVS, from Walgreens. I ordered it on DoorDash the other day, and do the home test, but please don't ignore symptoms in case it's COVID. All right, so let's turn and talk a little bit about some of the work in behavioral health.
Yeah, great.
So, let's maybe start with some of the mental health piece, because I think that this has been certainly something we've heard a lot from, and I'm, seeing some comments and questions here already. COVID has hit everybody, I would say, from a mental health standpoint.
Yeah.
Talk a little bit about, what has the department done? What is the department doing? Do we have enough access to mental health in Chicago? How do we think about this? How are we addressing it?
Yeah, I think from the beginning of the pandemic, we were planning for the idea that there were going to be impacts in other areas of health, including mental health, including substance use disorders. So we actually made a really substantial investment in the city's mental health system. In October of 2020, we invested $8.5 million in federally qualified health centers and community mental health centers that allowed them to hire more staff, grow programs, and that was primarily in communities that were disproportionately impacted by COVID, right? And that was something that we did very intentionally. We looked at other criteria that guided the communities we chose, and what we've seen since that investment is a substantial expansion of mental health services in those communities. And that's what I expected was going to happen.
Yep.
I think conservatively, we're going to deliver mental health services this year to probably 5 times more people than was the case in 2019 when the mayor came into office initially.
You mean in this publicly funded system?
In this publicly funded system. So way more people getting care. Another thing is we're really ramping up what we're doing in our own city clinics. So you may be aware, we have 5 of our own city clinics. All of them moved over to doing telehealth, something we had never done before. We just started delivering services to children and adolescents last week. So that's something that the city stopped doing in the 90s. We just started expanding our hours of operation, which is something we're going to do across all sites ultimately. So we've done a lot there. We've also been really investing in teams that actually work outside the walls of clinics. And Dr. Arwady, you and I talk about this a lot, that we talk a lot about clinic-based care. So when people get mental health care in a clinic, a lot of folks, especially that have more complex concerns, are better served by models that go beyond clinics, that deliver services in the home, in the community, et cetera. And so we've really started funding a lot of that. And then, a big thing that's starting shortly is integrating mental health professionals into the 911 system. So we've been really, really busy. As you know, a lot of our public health staff were redeployed to COVID. Primarily my staff was not, because you and I discussed that and we anticipated that there were going to be these impacts. We've seen increased rates of loneliness and social isolation, anxiety, depression. As far as suicide goes, nationally there actually was not a substantial increase in suicide. That was the same thing here. There was actually a slight reduction nationally in suicide. Our numbers were flat, but what we did really notice was that there were certain subpopulations where we were seeing some increases. And again, particularly in Black communities and among older adults. And so we were keeping those things in mind as we were making these investments in the communities that were most impacted by COVID.
Yeah, absolutely. And I think there's a long way to go where we're thinking about really building this system and trying to help coordinate it, make sure people know how to find resources, lines they can call. I know we're planning to do some more sort of outreach work, et cetera, and really trying to make it so that where folks are needing mental health, in the same way that we've got systems that you can get your physical health care, really regardless of your insurance status, your
Yeah.
socioeconomic status, your immigration status. You know, we absolutely consider mental health part of health and want to make sure, you know, these investments that the city has been making are very explicitly in settings where all of that is true. That,
Yes.
that you know, for people who are low income, there is a sliding scale that goes all the way down to zero. You know, and in our clinics too, we see people completely, you know, regardless
and I
of
think,
that.
you know, we've really made a big focus child and adolescent mental health services.
Yeah.
So when we invested in these 32 health centers around the city, 28 of them started or expanded child and adolescent mental health services programs. That's why we're choosing to start a child and adolescent program within our own clinics.
Yeah.
We saw increases of crisis among kids.
Yeah.
Increased rates of hospitalization. And I think a lot of that was the disruption in routine and structure. Kids that had underlying developmental disabilities, for instance, that weren't getting the therapeutic services during the pandemic that they were getting before. And so I think we really are trying to expand and better coordinate that system too.
Yep. All right, good. So there's a number of comments here, I think, about violence.
Sure.
People are questioning whether there are more people dying of gun-related homicide, dying of COVID, dying of opioid overdoses. You know, where does some of that fit in? I will start with that,
Sure.
if that's okay.
Yeah.
You know, I said right at the beginning, we've had about 5,600 COVID deaths. And if you look at just last year, so within 1 year, you know, that was nearly 5,000 within that year. So that was our COVID deaths just for Chicago residents. Can you put in some context, you know, maybe like opioid overdoses or?
Yeah, so, you know, there was some similarity in terms of violence and opioids in the sense that between 2019 and 2020, you saw substantial increases in the number of homicides and in the number of overdoses across between 2019 and 2020. And you saw that nationally, right? That was true nationally. It was true in Chicago. You know, around a 50% increase in those. It was not the same. It was much less than the COVID deaths. So in 2020, for instance, we had around 1,300 residents that died of a drug overdose. And then we had between 700 and 800 residents that died of homicide. And as you mentioned, it was, you know, to the order of 50, you know, above 5,000 for COVID. I do think it's important, though, to point out, you know, nationally, when it comes to drug overdose, we had 93,000 people die in 2020 of drug overdose. That's the worst year ever. More people are dying of drug overdoses than homicide. More people are dying of drug overdoses than of vehicular deaths. It's an issue that we need to talk about a lot more.
That's right.
It's a complex issue. It's not a new issue. Overdose epidemics have been a reality in the United States since the 80s. What they've looked like has changed, and we can talk about the waves of that.
Yep. And so, you know, correct me if I'm wrong here. Just sort of on the numbers. You know, in 2019, obviously our COVID deaths were zero. Our gun-related homicide deaths were a little under 500,
That's right.
I believe. And then our opioid overdoses were in the 850, 900 range.
That's right.
Is that right? And then as we went to 2020, we saw this huge amount of COVID deaths, but we also saw, you know, the homicides go from, you know, just under 500 to
almost 800.
Almost 800, and we saw opioid overdoses go from, you know, 800 to 1,300. Okay.
Yeah.
And so, is that similar? I mean, is that in line with what we've seen around the country? Do you have a sense of that? You know, we've got folks saying, are we seeing similar trends here?
Yeah, so you are seeing similar trends, you know, nationally in terms of really significant increases in homicide death and overdose death. You know, as I mentioned, it was the worst year for overdose death nationally ever. The increases in Chicago are significant, as they are in a number of large cities. And, you know, part of that, in terms of why, people ask me that a lot, some of it is we're seeing more and more deaths that are connected to what we call synthetic opioids. So these are opioids that are much more potent than heroin, so fentanyl and variations of different types of fentanyls. At this point, over 90% of our overdose deaths in the city of Chicago involve fentanyl. And it's mixed really across the drug supply. So it's not just in what people believe to be heroin, it is in cocaine, it's in methamphetamine. So it is truly the case that when you are using drugs, people often do not know what they are using.
Yeah.
And so, you may not anticipate at all that you have any risk of an overdose because you think you're using a substance that doesn't include a component that would normally really be correlated with an overdose death. And that's a significant change. We track the toxicology results of our overdose deaths, and we're at a point where fentanyl is just across the drug supply. That was a big issue during the pandemic. Another thing was disruption in services, disruption in treatment. So people returning to use who had not been using, their tolerance is lower, and then they use a substance that they had not used for a period of time, and it includes some of these potent components, even in small amounts, at very high risk for an overdose. You think about the disruptions in the overdose prevention programs. We, during the pandemic, were really trying to get naloxone, which is a drug that can be used to reverse somebody that's had an overdose. We were trying to push that out, get street outreach workers out into the places where we were seeing the most overdoses.
All right, good. And we've got a follow-up question here. I don't want to hear all about data. I want to hear about what are we doing about this.
Yeah, no, the point of collecting data is not to just throw it on the heap and say, isn't that interesting? So I'll give you some examples. So I'll talk first about overdose. So one of the things that we're doing is we're using our data to know very specifically where we're seeing the most overdoses, and then what we're doing is we're increasing our funding for teams that are out there not only getting people naloxone, but something called fentanyl test strips that allows people to test the drugs they may use to see if there is fentanyl in them, which allows them to then make decisions about how to best mitigate the risk. We have been funding programs that are actually out there starting people on medications that substantially reduce the risk of overdose. So this is called medication-assisted recovery or medication-assisted treatment. These are drugs that treat substance use disorders, but also significantly reduce the risk of overdose. So there are mobile units that are out there assessing people, prescribing those drugs for people in the places where we are seeing the most overdose. So it's very much about pushing services outside the walls of clinics. You heard me say that about mental health. When we're talking about overdose prevention, we're not talking about sitting in a room somewhere. We're talking about getting people out into the streets. I can tell you, Dr. Arwady, the intersections I'm most worried about. Yeah. I mean, there are 50 intersections and streets, and I want our teams out there. We met with all those teams 2 weeks ago. You were there. And we're creating data dashboards that are allowing these street outreach teams in real time, just like you do with COVID data, to see the opioid data. So I think that the connection to data is key, but to the person's question, this is not an academic exercise. This is about saving people's lives. Yeah,
and I think, this has been one of the biggest things for COVID for us, I think. Like, we've long looked at data at the health department, but the way that we have been using this data in sort of almost real time, right, is important, and it takes a lot of resources, but it means, especially if you're looking at things like overdoses, you want to really be up to date, right?
That's
yes,
right.
You want to understand the large year-long patterns, but also how can we adopt activities, how can we put resources where they're most needed.
Yeah, I mean, if I have a team of outreach workers that are working in a neighborhood where we have a lot of overdose, don't you think it would probably be helpful to know in the prior week, where did we see those overdoses? Right? Yeah. That's going to affect where I send my staff, like where do they go, when are they there, what supplies do they need with them. So I think in COVID, you all have pushed us, I think, across the health department to figure out how do we leverage data in the way that we have in response to COVID.
All right, great. We are already almost at time here, partly because we started a little on the late side. It does. Let me just hit a couple of these quickly. Kevin Lamanna on Facebook is asking, is there any consideration at CDPH for tracking local breakthrough cases, similar to some West Coast cities, for data transparency and or genomic surveillance? There is not only consideration of it, it is happening. So yes, although formally we report to the state and then to CDC breakthrough hospitalizations and deaths, we also track all breakthrough cases. And literally every time someone is diagnosed with COVID in the city of Chicago, there is a case investigation, there is the contact tracing, and if it is, we match every single one to see, did this person have COVID before? Like, is this a second infection, which makes us concerned about a variant, and or is this person vaccinated? If they are, they go on sort of the special list, and we're looking for patterns there. and we do focus, and those are some of the graphs that we'll share out. So yeah, I think it's really important for transparency, for genomic surveillance, and for us to understand what's happening here. Let's see. There's I'm gonna get many things here. Let's take, Matt Dominski actually had sent in a number of really thoughtful questions. We're not going to get to them all, but maybe I will take just this first one because it's a good one and it's time relevant. He asks, is there more information about the clinical first people who received the vaccines? I assume they're still being monitored. And he's saying advertising the fact they're being monitored, could be helpful. So yes, absolutely. And the reason I chose that one today is that we have now passed the 1 year mark. So Tuesday of this week marked 1 year since the phase 3 trials started with the Pfizer vaccine here in the US. And so we are now at a point where all of those folks in the trial, tens of thousands of them, have continued to be followed. We've not seen any long-term safety concerns. They stay in the trial, there's actually for a number of years for follow-up. But there is starting to be now that full year of that safety data. And as expected, we don't see in vaccines typically issues outside the first 6 weeks. Most commonly, if people are going to have any issue with a vaccine, it's quite immediate. But it's, in sort of the history of vaccines, it's in those first sort of few weeks. But nevertheless, we do all of that monitoring just to ensure we're not seeing anything long term, and the data's been really reassuring there. So so good question there, and we can get some more details, but they're doing fine. There hasn't been anything that has emerged in that long-term group. Okay, if we did not manage to get to your question today, we will have a chance to get it next time we're back, and I know there's a lot of interest and a lot going on, so we may go back to a twice a week standing here. But I want to, thanks again, Matt Richards.
My pleasure.
Thanks for folks who are writing in with questions about that. It's such a big space, and it's an example of the indirect impact that COVID has had, and it's something. Although on here we're talking a lot about the direct impacts of COVID, the health department behind the scenes is doing a lot of work in all of the indirect ways that we have seen COVID really continue to affect our health. So thanks to you and to your whole team for all of that work. As I was walking over here, I saw a good line of people outside getting their testing for Lala. We are definitely, keeping good track of what's happening there in terms of who's coming in with vaccine and testing. And really, just as a reminder, if you're coming, you've got to have your vaccine card and/or proof of a negative test within 72 hours. You will be turned away if those are not available. The Lala team is taking care of all that. If you have symptoms, don't come, and if you're not vaccinated, wear a mask. So nothing different than what we've been saying all along, but I'm really, I've been pleased to see people doing what they need to do to help make that be, it's not a no-risk situation, but it's really as safe as we're able to make it within what's possible. So thank you for all of your attention, and we will see you back next week.